December has been recognized as Constipation Awareness Month to educate you about how general public can keep themselves free from this issue. Okay, so when do you define a person suffering from constipation? Shriya. So a person is considered to be constipated if they have 3 or lesser number of bowel movements. Okay, if they pass stools 3 or lesser number of times in a week, or if they have a bowel movement that is painful, hard and dry. Okay, either of it, if they are suffering, then the person is said to have constipation. And excessive straining. Bowel movements are essentially painless, not like every bowel movement should be painful. If that is what a person is suffering from, unknowingly he is suffering with constipation. Okay, this many of them will not be aware. They think this is normal. Many of their threshold will be increased, thinking that is normal. It is time that they identify the issue and bring a change about their lifestyle or whatever is the underlying cause that needs to be identified. And then feeling of incomplete evacuation. When you say feeling of incomplete evacuation, even after passing stools, the person will have the feeling to pass stools. Okay, that they'll have that sensation or that satisfaction of evacuating the bowel will not be there. So that is what we call as incomplete evacuation. If these are there, the person might be suffering from constipation. Okay. So the symptoms, what the person will experience: painful bowel movements, cramps will be there, a feeling of bloatedness, a general feeling of you won't feel light, you won't feel active, you will not be able to carry on with your routine activities, you will become sluggish in your overall activity. The mentation itself will be affected and will be uncomfortable when dealing with any of your regular activities. So these are some of the symptoms. Okay. A brief diagram of how the food passes and how the defecation reflex works. Okay, when there is food in the stomach distends, and there is something called as gastrocolic reflex. And then when the food passes into the duodenum or small intestine, there is something called as chyme that is secreted from duodenum. That is called as duodenocolic reflex. So these both will stimulate the colon. Okay, when the colon is stimulated, there is mass contraction of the large bowel. So the content empties into the sigmoid and into the rectum. The rectum distends, internal anal sphincter gives way. It's an involuntary muscle. Okay, it gives way because of some local reflexes to the S2, S3 nerves. Because of parasympathetic reflex, the local nervous reflex, the internal anal sphincter relaxes. Okay, this is normal. And there are some signals that go to the brain as well. Okay, there comes the role of voluntary contraction. So that is when you identify whether you can defecate in a situation or not. Okay, defecate at that particular time of the day. So that is controlled by your external anal sphincter. Okay, this internal anal sphincter, it's important when we are treating certain conditions like fissure. This is what we'll be targeting when we are treating fissure. We keep telling we do fissure surgeries, and then the doubt arises whether if we cut the muscle that is contracting the anus, will they not develop incontinence. So this is where the control is involuntary control, and that is what we'll be targeting. So this understood, we'll see what are the causes of constipation, common causes. So yeah, lifestyle. Of late, everybody has been pushed by major life goals, and that makes them necessarily not able to pursue a healthy lifestyle. Okay, so everybody is running behind a schedule, running with a schedule, and so we will not be able to drink enough water. And stress of can be many things: financial, family issues, stress at workplace. So any kind of stress, this will have impact on your bowel. Okay, we might think, okay, everything is fine, I am drinking enough water, I am having enough good food, but why why am I constipated? Stress, unseen, unknown stress will majorly contribute to constipation. Then unhealthy diet. In this picture you can see there's a hot dog, there's a burger and fries. There is a major common junk food that is attracting everyone, children and adults equally. So this kind of refined flours and highly processed food, this is something again that will cause increased constipation. Inactivity. With all the advancement in technology these days, everybody has essentially become a sedentary person. So our lifestyle has essentially become sedentary. And then there are a lot of medications that cause side effects as constipation. I have a list of medications, so we'll see that as well. And major schedule changes. Lot of my patients, I've seen a lot of staff nurses coming to me with the same complaint. The shifts they work, they're not be able to take water at the right time, water in the right quantity, and they'll have to hold their urge to defecate a lot of times. So this is one thing. And I've had a patient who's a pilot. Okay, so she's been flying long trips, long flights, international flights, and she's been majorly suffering from this, so much so that she had to take a break from work. This is what we are looking at. So all the achievements then are getting stopped because of something so simple as constipation. Okay, and pregnancy. Pregnancy is yet another unavoidable condition that aggravates constipation. Okay, and we have some more causes in children. This list is essentially about functional constipation in children. There are a lot of organic causes, okay, like anorectal malformation, Hirschsprung's, spina bifida. These are some of the functional things which you'll have to address. Okay. Apart from that, in children, when they are everything else is fine, you will have to look at this. Okay. So it can be a home-related stress, school-related stress, siblings, issues with siblings, parental issues, low socioeconomic status, poor child rearing styles, dietary issues. A lot of children will be allergic to cow's milk protein. Okay, and diet low in fiber, providing them a lot of junk food, not having regular meals with parents. Both are two different things. Food not on time and food not with the family. Okay, this impacts the child mentally. And then childhood obesity and abuse, physical, sexual or emotional abuse, and general unrest of the country also might have an impact on the child's digestion. In adults, again, same. Inadequate fluid intake of diet that doesn't have fiber. There's something called as irritable bowel syndrome. Irritable bowel syndrome is when the person has alternating diarrhea and loose stools. Okay, they will not have any other organic cause, and they'll be passing lot of mucus. Okay, chali mari pogudhu solluvaanga, and there'll be anal spasm and accompanied by cramps. Okay, these are all essentially all other organic cause is ruled out, and they will have alternating diarrhea and loose stools. Okay, then they will be fitting into the category of irritable bowel syndrome. Pregnancy, painful anal conditions, medicines and hormonal imbalance, overuse of laxatives. I'm going to give a list of laxatives, different types of laxatives and how they act, so that you will choose the right choice of laxatives are important, and that some of the laxatives you will see that they can also cause constipation. Okay, and then certain comorbidities, dehydration, spinal cord injuries, suppression of the urge to have a bowel movement. This is yet another thing which commonly causes functional constipation in many of us. Lack of physical activities, certain medical conditions, and aging. With age, you will see that fecal impaction, constipation is a common problem. Okay, as the age, you would have seen staff working in ICU, you would have seen that patients over the age of 70, 80 commonly suffer with constipation and have to be regularly given laxatives. Some medications causing constipation. narcotics, opioids, morphine group of medicines. Okay, antacids, which especially contain aluminum, antidepressants, iron supplements, iron tablets, diuretics. That's a larger list. So iron supplements, since almost 70 to 80% of the Indian women suffer with anemia, and especially in pregnancy, they need to be given iron supplements. On top of it, pregnancy per se aggravates constipation. So it's a superimposed risk factor. And some other drugs, anticholinergics, antihistamines, anti-Parkinson, neurological medicines, all these are neurological medicines, phenothiazines, tricyclic antidepressants, some antacids containing calcium carbonate and aluminum hydroxide, barium sulfate, calcium channel blockers, diuretics, again muscle blockers and iron preparations. Okay, this is a larger list. If you want to know what kind of medications you need to be aware of when the patient is complaining of constipation, okay, either to titrate the dose or to stop the medication or change the dosage. So we've looked at the causes so far. How do you treat it? So how do you treat, what is your idea of treating a constipation? I think it's nothing new, and everybody will have their own, say, their own home remedies. Okay.
Exercise
yes, so that is covering 80% of my presentation. Tani, fiber, exercise, anything else? So treat the cause. We've already seen the cause, so address the cause. So this is a representation of what a high fiber food will be. You should not eat all of it together. Again, mind you, that is going to cause you again constipation. So this picture is a pictorial representation of what you can include in your food for treating or for making you free of constipation. So you can eat greens, beans, whole grains, dry fruits, fresh fruits and veggies, to name a few. Okay. You have to limit food with no fiber, say like cheese, meat, excessive meat again. A nominal amount is needed for everybody to build up their muscle strength, but excessive meat will again not have fiber in it, and it might lead to constipation. Then sweets, processed foods, foods with refined flour. When I say foods with refined flour, what we are looking at is something like pizza, burger, rusk, biscuits. Okay. Now a lot of healthy options, so-called healthy options of the same biscuits have come, digestive biscuits and all that. Okay. So average adult needs around 20 to 35 grams of fiber every day. And then water, how much should you drink? An average adult, again 2 to 3 liters or 8 to 12 cups. Whatever fluids you take, that will be counted towards your fluid intake. One of the primary jobs of colon is to reabsorb the food, all the nutrients, all the digestion takes place up to your IC junction, okay, ileocolic junction, that's what we call. And from the colon job is to absorb water and form feces. Okay, so this absorption of water, when there is not enough water, hard stools are formed, and we know the consequences. Without enough fluid, stools will become hard and difficult to pass. There is yet another thing I need to mention, alcohol and excessive caffeine. For some people, as a routine, caffeine aids in treating constipation, but excessive caffeine again will cause constipation. So yeah, some of the things you can do to alleviate or keep yourself physically active. Yoga, they say, is very good. There are specific yogas for alleviating constipation. Then regular walks, say 30 to 40 minutes of walk 5 times a day, 3 to 5 times a day. Jogging 3 to 4 times in a week. See, these exercises again should not be done on all days of the week. That is another thing. When we say physical activity, everybody will start excessive activities on including all 7 days of the week. You need to give time for your body to recover. Again, it will cause dehydration. Excessive physical activity, over physical activity will again cause dehydration, and some mild core strengthening exercises. These will help with constipation. These are not like general physical activities alone. This will help with keeping your body active and keeping you away from constipation. So it makes you physically active, it increases thirst, and increased fluid intake happens. It also relieves your mind and keeps you stress free. So that it is helping you in 3 different ways. Okay. So yet another thing is training your bowel. Your biological clock, you need to train it. You cannot just pass stools at your whatever time of the day you wish to. Okay. So that is one thing. Every day in the morning or a fixed time, you train your bowel to evacuate it completely. And do not ever ignore the urge to defecate. Allow yourself enough time for a bowel movement. That is a relaxed and stress-free time for your bowel. So it is when we say, okay, what constipation? Why are we having a talk on constipation? It's not a serious condition per se, or it definitely affects the lifestyle, but it is not something endangering the life. But it can lead to complications like hemorrhoids, are commonly called as piles. Okay, it can cause piles, anal fissure. Anal fissure can cause perianal abscess. It can cause fistula nano. Okay, these are all 5 different perianal common conditions that we are dealing with. And fecal impaction. This is commonly seen in kids, mentally unstable patients, and in elderly people. Okay, these are the ones who will suffer with fecal impaction. Fecal impaction is something like when the stools are extremely hard, what happens, there will be mucus from the surrounding bowel that keeps shedding regularly. Okay, so you will think that patient is having incontinence, but in reality what is having, they are suffering with some hard stools in some part of the colon. So fecal impaction is yet another consequence of constipation. And rectal prolapse. Repeatedly, some people digitally maneuver to evacuate the hard stools. So repeated digital maneuvering will cause loosening of the anal sphincters, and it can also cause rectal prolapse. Okay, and in certain scenarios, it might be the only symptom of a colon cancer. Okay, what you might think as a simple constipation, especially in the elderly, it might be the only symptom of a colon cancer.
The colon cancer, 90% you associated with constipation?
Not always. More than constipation, obstipation is when we look at colon cancer or some growth in the colon. Obstipation is when the patient is absolutely not able to pass gas also, flatus also.
Do they leave any symptoms before that? Because I had a friend of mine. So they just went for a small test and then they had to leave abroad.
Okay.
So he was detected of colon cancer and they had to cut a part of it and so much.
Yeah, that's the treatment for colon cancer. Sometimes constipation may be the only symptom that the patient might be suffering with colon cancer. So
it doesn't leave any symptoms as such.
They will have abdomen distension, they will have vomiting, depending on which part of the bowel the cancer is. They will have loss of appetite, they will have vomiting. If it is somewhere in the stomach or small intestine, they will have excessive vomiting. If it is somewhere in the lower part, they will have abdomen fullness and obstipation, more commonly obstipation. Okay. So yes, we have seen the other modalities like the general lifestyle modifications. I'm going to slightly elaborately tell you about laxatives. Laxatives are commonly abused medications, so we need to know the right choice of laxatives. So what are the common laxatives and how do you choose a laxative? In whom do you avoid certain laxatives? Okay. So here the types of laxatives are bulk forming laxatives, osmotic laxatives, stimulants or irritants, and then we have stools softeners or lubricants. Okay, when we say bulk forming, It can be natural or synthetic. Natural from plant gum, agar-agar, psyllium and rice bran. And synthetic cellulose compounds like methyl cellulose and carboxycellulose. So what happens? These absorb water. These will absorb water and a bulk is formed. Okay, and this will cause peristalsis. So it will dissolve or swell in the intestine. You can imagine something like a silicone balls. If you put in water, they swell, they increase in size. So something similar to that. So they dissolve or swell in the intestine and they form bulk, and they stimulate peristalsis. They act in 8 to 24 hours. Okay, it is not absorbed from the intestine. You don't have to worry that it will go into the patient and cause side effects. No, it will not be absorbed into the intestines of the patient. So it is safe for using for a long term, and it is safe for elderly people. It's helpful in patients with irritable bowel syndrome, patients with diverticulosis and colostomies. When you create a colostomy for the patient to regularly clear the bowel, you need to give some bulk forming agent so the bowel is clear. So how is it taken? It's mixed with a glass of water, stirred and consumed immediately. If you keep it for longer time, that in itself can cause constipation, and followed by half a glass or a full glass of water. Insufficient fluid intake after this again will lead to intestinal obstruction. It's not appropriate for patients with kidney diseases because there is a limit on how much fluid they can take. So it is not appropriate for kidney failure patients or suspected intestine bowel narrowing, okay, esophageal narrowing or some strictures or large colon or small bowel strictures. When you are suspecting, do not give bulk forming agents. Next we have osmotic laxatives. Osmotic laxatives, there are some salts of magnesium, lactulose and glycerin. These are osmotic. When we say osmotic, it brings the water from the intestinal walls. So some salts, magnesium citrate, magnesium hydroxide or milk of magnesia. This is commonly seen in cremafin, along with liquid paraffin. Milk of magnesia is present. Then we have magnesium oxide, magnesium sulfate, sodium biphosphate, sodium phosphate enema, that is again commonly given, lactulose and glycerin enema. Okay. So how do these act? The earlier we saw that they swell up and they form the bulk. These will cause they are insoluble, they remain in lumen and pull water from the colon and increase water in the feces. Okay, this is the way that this works, and it will increase the bulk and peristalsis. Lactulose draws water into the intestine and promotes water and electrolytes retention. It decreases serum ammonium level. That's why if you had seen, we use lactulose in hepatic encephalopathies, patients with blood vomiting. Rattavandi varavalukku lactulose kudupom, because that blood, everything will be cleared, and ammonia causes hepatic encephalopathy. So this helps in decreasing ammonia levels. So glycerin, it acts like lactulose. So low glycerin enema is yet another thing that we routinely give. So it's a osmotic laxative. So where do we use for colonoscopy, sigmoidoscopy and barium enema? To prepare the patient for barium enema, we use this. Okay, lactulose is used in liver diseases. So since it's all magnesium salts, there can be side effects of hypermagnesemia. What does hypermagnesemia cause? It causes drowsiness, weakness, paralysis, heart block, complete heart block, hypotension, flushing and respiratory depression. Lactulose can cause general GI disturbance like flatulence, diarrhea, abdominal cramps, nausea, vomiting and variation in the sugar values. Okay, in diabetics. And you should use all this with caution in patients with congestive heart failure, kidney disease and high blood pressure. You should not use laxative that is containing high sodium. We've seen two, now we are looking at the third type, that is stimulant or irritant laxative. So what is this? Castor oil, anthraquinones and diphenylmethanes. Anthraquinones, we have senna and cascara sagrada. Senna is avarumbu. Okay, this cascara sagrada, I couldn't get the Tamil name. It's again a compound that will become an active form of anthraquinone, and diphenylmethanes, bisacodyl and phenolphthalein.
Varambo, you just like that we can take it.
And there might be different formulations. In Ayurvedic, these mainly used in Ayurvedic preparations, dried and powdered. So these, how does it work? It increases water and electrolyte secretion by the mucosa, and it will stimulate or irritate the nerve endings in the GI mucosa. So feces are moved through the bowel too rapidly to allow the absorption of fecal water, so a watery stool is eliminated. And then Dulcolax or bisacodyl, it is given in different formulations like oral, as suppository, or as enema. It it takes 15 to 30 minutes when given as a suppository, and 6 to 10 hours when given in the oral form. Okay, this is again one of the common medication which we routinely use in your ward. Okay, then Senna and Cascara sagrada, this passes unchanged into the colon. These on the intestinal bacteria, on acting on them, they turn into active compounds. Okay, this become anthracene derivatives. This will then absorb and have a direct irritant or a stimulant effect on the myenteric plexus, which is causing the mass contraction of the colon. Okay, are you getting it? There is something called as mass peristalsis of the colon. Okay, that is one thing that will propel the content or the stools into the sigmoid. So that myenteric plexus are stimulated. Then you have castor oil. Excuse me. It is hydrolyzed in the upper small intestine into ricinoleic acid. It's a local irritant causing intestinal motility. So it acts within 2 to 6 hours. Used for colonic preparation for colonoscopies, surgeries, and barium enemas. So some of the side effects: phenolphthalein, it will alter the urine color, nausea, abdominal cramps, and it can cause general body weakness. Bisacodyl, it will cause fluid and electrolyte imbalance can come, and cramping and diarrhea can be there. Castor oil, it stimulates uterine contraction, sometimes can cause spontaneous abortion, so cannot be used in or should be used with caution in pregnant ladies. Senna, it will cause the damage of the nerve endings because it's an irritant, and there will be loss of intestinal muscle tone. Okay, so chronic long-term use of this stimulant can cause loss of colon function. Okay, and colon becomes into what is called as cathartic colon. Consequently, constipation becomes increasingly worse and unresponsive to any other medication that you give. So we abuse these stimulants or irritants, and then we'll not be at loss of which kind of laxative to give. Then we look at some stool softeners. The active ingredient in most stool softener is a medicine called docusate. This prevents hardening of the stool by adding moisture to the stool. It becomes emulsified with stool. Yet another example is liquid paraffin. That is also a stool softener. So they decrease the surface tension of the fecal mass to allow water to penetrate into the stool. So it's used to prevent constipation, commonly recommended for patients who should avoid straining or defecating after a pelvic or rectal surgeries, after abdominal surgeries, post surgeries. This will cause easy defecation. So post childbirth or after a heart attack, patients with severe high blood pressure or hernias, patients with painful hemorrhoids or anal fissures, these are the ones who have who can be given this laxatives. What are we talking about? Stool softeners. Okay. Then mineral oil. Again, it's a lubricant laxative. It coats and softens the stool. Softens stool by retarding colonic absorption of the fecal water. Exact mechanism how this mineral oil is used is not known. So used by patients who need to avoid straining. What we had already seen: heart surgeries, post heart attacks, childbirths, and hemorrhoids. So it should be avoided in patients taking blood thinners such as coumarin derivatives. Okay, it decreases the absorption of vitamin K, which is important in the formation of clotting factors in the blood. Okay, and it should not be taken during pregnancy. Again, it will inhibit the absorption of the vitamins and decrease the availability of vitamin K to the fetus. Again, it can cause pneumonia if it leaks into the lungs. Chemical pneumonitis can happen. Then coming to the end, we've seen the different types, and this is yet another formulation. Basically, enemas and suppositories are formulation. All these we had seen are oral. These are used to relieve constipation and rectal fecal impactions. When there is impaction, these are the ones which are commonly. You cannot push from above. More often preferred one will be manual evacuation or suppositories or enemas. Okay. In conjunction with oral laxatives and cleansing the bowel in preparation for barium studies. So some enemas, commonly we use sodium phosphate enemas, okay, low glycerin enemas, dulcolate suppositories, and clean enema, it's sodium biphosphate enema. It contains sodium biphosphate. So that's about laxative. The choice of right laxative is important. Now you must have known not everybody you can give the same laxative. Okay, so yet another thing I want to emphasize on is the position of passing stools. Okay, so in the usual Western closet, the person usually sits. There is something called as anorectal angle. The muscle called puborectalis, which is like a sling. Okay, between the rectum and anus. What we call as malakodal, between the rectus and anus there is a muscle that will form a sling. Okay, if this is not straightened, the person cannot defecate completely or comfortably. So this is what happens in a regular sitting position. This is what happens to the lower end of the rectum and anus in a squatting position. Okay, when they squat it straightens and there is complete evacuation. So regular training in a squatting position, or if you're using a Western toilet, this position, if it is maintained, a low seated or a low lying closet will help in complete evacuation.